Friends, today I will tell you about the axis vertebra. This is the second cervical vertebra, and this is a typical type of cervical vertebra, and the name of this vertebra is axis vertebra. This is given the name axis vertebra because it acts as an axis for the rotation of the head. So here you can see a process. This is known as dens or the odontoid process. So this process forms a pivot joint with the anterior arch of atlas, and that act as an axis for the rotation of the head. So that is why the second cervical vertebra is known as axis vertebra. Now we will see some part of this vertebra. So to identify know how to keep this vertebra in normal anatomical position. So this what you are seeing here, this is a process known as odontoid process because this process is tooth-like, so the name is given odontoid process. It is also known as dens of the axis. Here you can see this is the body of the axis. So anteriorly you have to keep the body of the axis vertebra, and on the superior side of this body you will find a projection. This is the dens or the odontoid process. So you have to keep this vertebra in such a position that this body should lie anteriorly and the odontoid process should lie superiorly. And another feature is you can see here a facet. This is the superior articular process on which you can see the facet. So the superior articular facet is much larger in comparison to the inferior articular facet. Here you can see this is inferior articular facet which is smaller in size, while this superior articular facet is larger in size. So this articular facet, the larger articular facet should face superiorly and the body should face anteriorly. So you have to keep the vertebra in normal anatomical position like this. This is the anterior side and behind this you have posterior side. Now we will see the detail of each part of this axis vertebra. This part what you are seeing here, this is the process, this is known as odontoid process or the dens of the axis. This is basically the detached part of the atlas vertebra. What happens, the centrum of the during development or the vertebra, the centrum of the atlas vertebra get detached from the atlas, and it is attached with this body of the axis vertebra. So this process is odontoid process or the dens. It is having an anterior surface, and posteriorly you will find the posterior surface of this dens. You will have an apex of the dens, and then you have the base of the dens. So this tip or the apex of the dens gives attachment to a ligament that is known as apical ligament of dens. And on the side of this apical ligament, the sloping area over here on the lateral side, it gives attachment to another ligament that is known as alar ligament. So the apical ligament connects this axis to the cranium, and also the alar ligament also attaches this axis to the cranium. So you have the apex. On the tip of this odontoid process, you will find attachment that is known as apical ligament of dens. On both sides of this sloping area, you will find attachment of the alar ligament. On the anterior surface of this odontoid process, you can see there is an oval facet. This oval facet articulates with the anterior arch of atlas and forms a median atlantoaxial joint, and that joint is pivot joint and on which the atlas rotates. So here this is your atlas vertebra. So this is the anterior arch of the atlas, and on the posterior surface of this anterior arch you will find an facet over here. On this facet the odontoid process of this axis vertebra articulate, and on this the atlas and the whole of the cranium rotate, and that is why it is known as axis vertebra. And the base of this odontoid process merges with the body of this axis vertebra. Now on the posterior surface of this odontoid process you will find a groove over here. You can see a groove over here, and this groove gives passage to a ligament that is known as transverse ligament. So in this diagram you can see this is the odontoid process of the axis vertebra, and here at the tip of this odontoid process you can see there is attachment of the ligament. This is known as the apical ligament of dens. On both sides of this tip, this is the sloping area, and on this there is attachment of another ligament that is known as alar ligament. Now I have told you about this groove on the posterior surface of this odontoid process, and this groove lodges a ligament that is known as transverse ligament that supports and that stabilizes the median atlantoaxial joint. So these are the ligaments that are attached on the odontoid process of the axis vertebra. Now moving on to the body. So you can see the body is having an anterior surface and a posterior surface. So on the anterior surface, you will find attachment in the midline. You will find attachment of a ligament that is known as anterior longitudinal ligament. So this body on anterior side, it gives attachment to the ligament in the midline, and this is ligament is known as anterior longitudinal ligament. On the side, on both sides of this anterior longitudinal ligament, you will find attachment of a muscle that is known as longus colli. So longus colli is attached anterior surface of the body lateral to the attachment of the anterior longitudinal ligament. So here you can see the attachment of the muscle that is known as longus colli. On the posterior surface of this body, this is the posterior surface of the body of the axis vertebra. This provides attachment to certain ligaments in the membrane. So from superior to inferior side, you can see the superior most attachment is the attachment of a vertical band of cruciate ligament. So the vertical band of cruciate ligament, the inferior part of the vertical band of cruciate ligament is attached superiorly on the posterior surface of the body. Beneath this, you will find another ligament that is known as membrana tectoria, and most inferiorly, you will find attachment of the posterior longitudinal ligament. So from superior to inferior, you will find attachment of the vertical limb of the cruciate ligament. Then we will find the attachment of the membrana tectoria, and more inferiorly, you will find attachment of another ligament that is known as posterior longitudinal ligament. So if you see this diagram, this is the posterior surface of the body. So you will find three attachments, three fibrous structure over here. The superior most is the attachment of a vertical limb of inferior, so the inferior part of the cruciate ligament. And here is the attachment of the membrana tectoria. And more inferiorly, you will find attachment of the ligament that is known as posterior longitudinal ligament. Now, the second part is your vertebral arch. Just like other vertebra in the vertebral column, we have this vertebral arch. This vertebral arch, you can see the small part that is known as pedicle, and then you have the larger part. This is known as lamina. This is known as lamina, and both the lamina converge in the midline and giving a process. This is known as spinous process. So in this diagram, you can see this is the body, this is odontoid process, and this part is known as pedicle, and this hole is known as lamina of the axis vertebra. So, and in between the body, pedicle, and the lamina, you will find a large foramen over here in the axis vertebra, and this is known as vertebral foramen. This vertebral foramen lodges the spinal cord inside and along with its meninges and all the vasculature related to it. So spinal cord along with meninges and the vessels are you can find over here. Now the pedicle is short, directed posteriorly and laterally. This is the pedicle. It is directed posteriorly and laterally. You can see on the lateral aspect, you can see this is the pedicle. This is a short pedicle, and this is directed posteriorly and the laterally. And this is your lamina. This lamina gives attachment on its superior border. It gives attachment to the ligamentum flava. So the ligamentum flava is attached on the superior border and the anterior surface of the lamina. So this is the position of the axis vertebra. This is anterior side and this is posterior side. So the anterior surface of the lamina, which is towards the vertebral foramen. So this is the anterior surface of the lamina. So the lower part of this anterior surface provides, and along with the superior border, that provides attachment to the ligamentum flava. So ligamentum flava is attached on this lamina. Now the spinous process, the midline spinous process, it is the median position, the midline structure, what you're seeing here, this is the spinous process. This is bifid, as you can see, there is two processes. So this is bifid spinous process like other cervical vertebra. So this gives attachment to a ligament that is known as ligamentum nuchae. So the ligamentum nuchae is attached on this spinous process. So second thing is the coming on to the muscles attached over here. So just lateral to the attachment of the ligamentum nuchae, we have a muscle attachment over here. This is known as rectus capitis posterior major. So the rectus capitis posterior major is attached on the side of the spine, and then we have the other deep muscles of the back, that is the deep muscles of the back, they are arranged on this lamina. So this lamina provides attachment to the external surface of the lamina. This is the external surface of the lamina, and this provides attachment to the muscles, the deep muscles of the back. And one more muscle, that is inferior obliquus, is also attached on this lamina of the axis, and we can see the arrangement of these two muscles. The inferior oblique lies in its upper part, the inferior oblique lies in the upper part, while the deep muscles of the back, they occupied on the external surface of this lamina lower down. So these are the muscle attached on the spinous process as well as lamina. Now coming on to the transverse process, you can see from this pedicle and the lamina, you have seen laterally there is a projection. This is known as transverse process. So in this transverse process, on both the lateral side, you will find transverse process. In this transverse process, you will find an opening, and this opening is known as foramen transversarium. This opening gives passage to, or the foramen transversarium gives passage to vertebral artery, the second part of vertebral artery, along with vertebral vein and the sympathetic plexus. So these three structures pass through this foramen transversarium, which is situated in the transverse process of the axis vertebra. Now, this transverse process is made up of, there is no costal element in the transverse process of the axis vertebra. It is completely formed by the true transverse process. So, this transverse process giving attachment to three muscles from anterior to posterior side, you can say. The anterior most, there is attachment of the scalenus medius. Then you have in the middle part, you have in the tip of the transverse process, you will get the attachment of the second muscle, that is your levator scapulae, and behind you will find another of the third muscle, that is the deep muscle of the back, is attached on the posterior side of this transverse process. So this transverse process is also giving attachment to three muscles. Anteriorly, it gives rise to the scalenus medius. Then you have posteriorly behind this scalenus medius, you have another muscle, that is levator scapulae, and more posteriorly you will find the deep muscles of the back. So these muscles are attached on this transverse process. Now coming on to the articular facet. Here you can, I have told you that there are two pairs of articular facet. One is your superior articular facet and the one is your inferior articular facet. So here you can see this is inferior articular facet and this one is your superior articular facet. So if you see the size of the facet, so the superior articular facet is larger in comparison to the inferior articular facet, and it is almost flat. There is no concavity. You can see there is no concavity in this articular facet. This articular facet, this faces, this the direction of this superior articular facet is upward and laterally. If you see the direction of the superior articular facet, this is the anterior side and this is the posterior side. So the direction of this superior articular facet is upward and laterally. So this is the direction of the superior articular facet, while the direction of the inferior articular facet is downward and forward. So the direction of the inferior articular facet is downward and forward, while the direction of the superior articular facet is upward and laterally. So this correspond to the because this articulate with the inferior articular facet of the atlas vertebra, and the inferior articular facet of the axis vertebra articulate with the superior articular facet of the vertebra cervical 3 vertebra. So this superior articular facet forms the lateral atlantoaxial joint, and this odontoid process forms the median atlantoaxial joint. So these are certain important feature and the muscle attachment regarding the axis vertebra. In this diagram, you can see here, this is the transverse process, this is the anterior side, and this one is the posterior side. So on this anterior side, you will find attachment of a muscle. This is known as scalenus medius. This muscle posteriorly there is attachment of another muscle. This is known as levator scapulae. Then more posteriorly, you will find the attachment of the deep muscles of the back. This whole lamina also gives attachment to the deep muscles of the back. And this is ligament. This is the ligamentum nuchae attached on the bifid spine. And just lateral to this, you will find another attachment of the muscle, that is your rectus capitis posterior major muscle. This is attached on the side of the spinous process. And here you can see this is the ligamentum flava that is attached on the superior border of this lamina as well as the lower part of anterior surface of the lamina. So these are all the attachment. Here you can see this is the superior articular facet which is directed upward and laterally, and the inferior articular facet directed, that is downward and forward. So these are the structure that is attached. These are the muscle that is attached. These are the ligament that is attached in the axis vertebra. Now, in some cases, the injury occurs in the neck region, and this atlas vertebra get fracture. The commonest site for the fracture is usually there are two important sites for the fracture. One is in the posterior element, and another one is your the dens. So dens basically more commonly it get fractured on the base of the neck, and the posterior element is most commonly fractured on the area of the interarticularis. So in between the superior articular facet and the inferior articular facet, we have a bony part, and this bony part is known as pars interarticularis. So this gets often fractured, and this causes the fracture of the axis vertebra. So this lead to the separation of this posterior element, and so most commonly this posterior element, that is pars intercalaris part, is basically fractured. So often in the hyperextension injury, such as in case of the head is hyperextended but the neck is fixed, in that cases the most common site of fracture is the fracture of the area of the interarticularis. Pars interarticularis get fractured, and this is also known as a hangman fracture. So hangman fracture is often asked in your Viva question. So this is basically the fracture of the part of pars intercalaris of the axis vertebra. So this is known as hangman fracture. And the secondly, in hanging also, this posterior element get fractured, and the patient dies. Secondly, you have there is loosening of the transverse ligament, and this axis vertebra get dislocated. So the stability of this vertebra is mainly by the transverse ligament. If anyhow the transverse ligament get loosened, or like in certain connective tissue disorder, there occurs the dislocation and the subluxation of the odontoid process or the axis vertebra. And also we can also find there is a weakening or the injury to the alar ligament that leads to dislocation and the subluxation of this axis vertebra. So this is all about the axis vertebra. You have to know its anatomical position, the part of this vertebra, how to keep it in anatomical position, and what are the attachment on this vertebra. So that's all for today's discussion. Thank you.